Assalamu alaikum warahmatullah. Bismillah ar-Rahman ar-Rahim. Thank you for inviting me to this important conference. Today I'm going to talk about protecting adults at risk against pneumococcal disease. I have to disclose that this lecture is sponsored by Pfizer and it's intended for healthcare professionals only. So what's pneumococcal disease? Pneumococcal disease is the disease caused by the bacteria Streptococcus pneumonia, which is gram-positive cocci, and it is the second most common cause of vaccine-preventable death in the United States. It doesn't only cause actually pneumonia from its name, but it also can lead, unfortunately, to bacteremia or meningitis, and it can be fatal if not treated. So it is obvious that it is better to prevent than to try and fight pneumococcal disease with antibiotic that might not work. This is why it's important to know about the indications of the vaccine, pneumococcal vaccine in the adults. The children, maybe everybody and like will care about children and their children, take them to get the mandatory vaccines. However, in adults, quite often we forget to recommend or offer this vaccine. So pneumococcal disease can lead to pneumonia, mainly lobar pneumonia. Actually, this is the typical presentation. It can present initially with cough and increased sputum production with fever, chills, and if not treated, probably it can lead to more severe presentations and confusion and hypothermia, leukopenia. And this is because it causes systemic inflammatory response and then maybe multi-organ failure in the severe form. And the severe community-acquired pneumonia or the invasive community-acquired pneumonia is defined by either presence of one major criteria or three minor criteria. The one major criteria is either the septic shock treated with vasopressors or respiratory failure requiring mechanical ventilation. On the other hand, three minor criteria can also qualify for the patient to have severe community-acquired pneumonia, which might include respiratory rate more than 30 breath per minute, or confusion or deterioration or both in the consciousness, hypothermia, hypotension, leukopenia, thrombocytopenia, uremia, or multilobar, more than two lobes involved with infiltrates. So one major criteria or more than three minor criteria will qualify the patient for severe community-acquired pneumonia. The main pathogens that can lead to community-acquired pneumonia, the most common one is the Streptococcus pneumonia, which we'll talk about how to prevent from. Other bacteria like gram-negative bacteria like Haemophilus influenza and Moraxella catarrhalis, atypical bacteria like the Legionella, Mycoplasma, Chlamydia, and some atypical bacteria and some respiratory viruses like influenza and the SARS-CoV-2. Of course, we're still having actually infections with SARS-CoV-2 with COVID syndrome and RSV, for example. And there are some other uncommon causes like the MRSA, the gram-negative bacteria like the Pseudomonas in certain virus groups, or Klebsiella pneumonia, and also some atypical bacteria and mycobacteria and other viruses and fungi and parasites. However, the most common one which we talked about is the Streptococcus pneumonia. And this can lead to either short-term complications or long-term complications. The long-term complications, in addition to the ones that we mentioned earlier, it can lead to development of new or worsening pulmonary disease like emphysema, or even development of new or worsening cardiovascular disease or neurologic disease, unfortunately. So it is like really a systematic disease that we need to work hard on preventing. We'll go back to pneumococcal disease. We have to know that it is common in children. This is why it's mandatory to give the vaccine series in children, but it is also common in older adults who are at increased risk of having severe form of the disease or serious illness or even death. And currently we have two kinds of vaccines against pneumococcal disease. The conjugate vaccine, which we have now, the PCV13 still available, and the newly established PCV15 and PCV20. The PCV20 just recently got approved by Saudi FDA in Saudi Arabia, and hopefully it will become available in the hospitals and in the centers. The PCV13 has been there for a while, since 2010, and for children and then later for adults. And we have also the pneumococcal polysaccharide vaccine, which is actually since 1983 is found, and it is the PPSV23. The PCV15 contains all PCV13 serotypes in addition to two more types. And the PCV20 have all the serotypes which are contained in PCV15 in addition to 5 more serotypes. And those are the most common serotypes that can lead to pneumonia, especially the invasive pneumococcal disease. Now, what's the difference between the conjugate and the polysaccharide vaccine? The polysaccharide vaccine is basically contains polysaccharide antigens, and it is T-cell independent. It only stimulates B cells to produce antibodies. On the other hand, the conjugate vaccine, it is basically the polysaccharide antigen itself, but it is covalently linked to protein carrier. Typically, it's the Tdap carrier or the tetanus protein. And it is T-cell dependent immune because it will stimulate T cells to help B cells produce antibodies. And by being T-cell dependent, it will generate immune memory. And this is the main difference between the conjugate and the polysaccharide. So the conjugate will reduce and generate, will produce or generate immune memory. Now, this slide will show the timeline of landmark changes in the vaccine history in the last 50 years. Maybe it's not clear to you. However, what is pertain to our lecture today are main dates. Like in 1977, there was the pneumococcal, the 14-valent polysaccharide at that time. And then in 1983, the pneumococcal 23 polysaccharide was introduced. And then in 2000, there was the heptavalent conjugate vaccine in 2000 was introduced. And since this date, the incidence, as we will see in children and in adults, has declined of the occurrence of pneumococcal disease, especially the invasive one. And then in 2010 was a landmark also change, which is the introduction of the 13-valent conjugate pneumococcal vaccine, and that was a landmark change. What's not shown here in this timeline is the introduction of PCV15 and PCV20 in late 2022 and early 2023. And its PCV20 now is approved in Saudi Arabia for adults. Now, this actually diagram shows the decrease in the incidence of invasive pneumococcal disease among children less than the age of 5 years since the year of 2000, when the conjugate vaccine was first introduced. At that time, it was the PCV7. And then 10 years later, when the PCV13 was introduced in children again, this led to further decrease in the occurrence of the disease in children. And what happened is that the occurrence of the disease did not decrease only in children, but it also, the introduction of the vaccine in children has led to decline in the incidence of invasive pneumococcal disease, even in adults, especially those who are more than 65 years of age. This is why, actually, in 2019, the ACIP introduced the concept of shared decision-making when it comes to giving the PCV13 to those who are more than 65 years of age, because of the already declining incidence of the disease from the vaccine which was introduced to children. Now, the major and landmark clinical trial which proved the efficacy of PCV13 is called CAPITA trial. It was actually conducted in Netherlands, which is a small country, and it was actually randomized controlled trials on 84,000 patients who were vaccine-naive subjects aged more than 65 years. And they were randomized either to receive the vaccine in one arm or receive the placebo, and they followed those patients for 28 days, and then in subgroup they followed them for 6 more months. And the primary outcome for the study was looking at the occurrence of vaccine-type community-acquired pneumonia, whether it is invasive or non-invasive. And the secondary outcome was looking at the occurrence of vaccine-type non-bacteremic, non-invasive community-acquired pneumonia, and vaccine-type invasive pneumococcal disease, which is the most important outcome. And the study was positive in all actually primary and secondary outcomes, and it is markedly actually was decreased the incidence of invasive disease in those patients who are more than 65 years of age by 75%, It was statistically significant in all, actually, in all outcomes. And the adverse events actually was consistent with that of prior studies in adults. Then there was post-hoc analysis of the patient population which were studied in this trial for 4 years, and they found that actually the effect of the vaccine lasted longer, and there was no waning of the efficacy observed in those patients after 4 years. So the effect of the vaccine continued for a longer time than the study design. Now, more studies were conducted in different age groups in the adult population, whether in younger patients or middle-aged or older patients for PCV13, in patients who were like PCV23 naive or those vaccinated with PCV23, especially patients with certain medical conditions and immunocompromising conditions. And they found actually, as a sum up of all those trials, that the PCV13 was not inferior to polysaccharide, and it was actually statistically significantly greater for the majority of common serotypes and for serotype 6A, which is not included in polysaccharide when it comes to outcome and preventing the disease. And the effect was more pronounced in younger population, actually, because their maybe immunity response is better. Now, in 2019, as I mentioned, the ACIP introduced the concept of shared decision-making. You discuss with your patient who's more than 65 whether they want to get the PCV13 or not. And polysaccharide is still indicated for this age group in that recommendation. However, moving to ACIP 2022, the patient who should get pneumococcal vaccines are obviously the children, and they get it in our country as mandatory for as part of the mandatory national vaccination program at the age 2 months, 4 months, 6 months, and 12 months in 4 doses. And it is recommended also to give patients who are more than 65 years of age. And also we can give the vaccine for patients who are not in those age groups, but they have certain medical conditions. Now, what are the certain medical conditions that I'm talking about? Certain medical conditions are the conditions that make the patient more actually prone to having severe disease from getting exposed to encapsulated bacteria, including Streptococcus pneumonia. And those patients are either patients with chronic diseases like chronic heart disease, liver disease, lung disease, or renal disease, and alcoholism, and some conditions like diabetes, which is very common, some patients like cigarette smokers, even as an indication, and other conditions which are more severe and immunocompromising, like HIV and leukemias, lymphomas, multiple myelomas, and sickle cell disease, and asplenia, and also in conditions which predispose patients to this kind of bacteria, and it increases the risk of meningitis, like the cochlear implant and the CSF leak. So those are the main conditions which actually for which the patients are indicated to give them the vaccine, even if they are not 65 years of age, and even if they got their vaccines in their childhood, if they are in the ages between 19 to 64. And remember well those 2 indications which are very common and probably we see every day in our daily practice, at least like 3 or 4 or 5 of those patients who is either smoker or having diabetes. And probably we forget to offer them a pneumococcal vaccine. Now, still PCV13 is the one which is available here before the availability of the more newer version, the PCV20. So we still need to know when to use it. We can use it in patients who are younger than age of 2 years of age, as I mentioned, and people with 2 to 18 years of age with certain medical conditions. In the PCV15 and PCV20, the ACIP recommends either PCV20 alone or PCV15 in series with polysaccharide. So if you have PCV20 available and there is indication to use it, no need to use polysaccharide with it. It's enough. And it will make our life much easier, and the vaccination history will be completed by giving the dose of PCV20. However, if PCV15 is available and you choose to use it, then you still have to use it in series with PCV23, like the PCV13 as we mentioned. Now, patients who are indicated for using those, according to the ACIP 2022, all adults aged more than 65 years of age, and adults the age of 19 to 64 with certain underlying conditions, as I mentioned, especially those who actually have not previously received PCV or whose previous vaccination history is unknown. Now, in patients who are less than 19 years of age, you can still use PCV15 instead of PCV13 whenever it is indicated. Now, if you want to use series of vaccines, PCV13 and polysaccharide, which one you should start with? Studies showed that starting with PCV13 first, followed by the polysaccharide, will produce better immunity than the other way around. So if you want to use the series